For this next session of the afternoon of the Future of the American Child journalism training, we're going to talk about a subject that has sort of been the underpinning of everything we've discussed so far, and that is trauma-informed care. So many of the children and families, particularly in immigrant communities, are dealing with residual trauma of their journey, of where they are now, what the future holds. And of course, as we talked about this morning, so many children in foster care or the child welfare system are also dealing with these issues. And so Monica Romo is a specialist in this field. She is the senior program coordinator for at the Texas Institute for Child and Family Wellbeing at UT Austin, and the program that she coordinates is called Girasol. Monica and I had some really good conversations about trauma-informed care, what journalists need to know specifically about what makes it different than basic psychiatry or psychology. So this is an important session for you to be able to glean that information and move forward in your reporting with a basic understanding of that. So, Monica, thank you for joining us, and take it away.
Thank you so much. I am part of Girasol, which is housed at the Texas Institute for Child and Family Wellbeing at the School of Social Work at UT. So it's like we're a tiny program inside of a really big institution, and we are the only program at UT that is dedicated to providing services and support to professionals that work with immigrant children and families. So I'm really excited to be here, and really happy to be presenting on this. Let's see. Okay. So Girasol started as kind of just the brainchild of a social work student at UT that was really interested in working with immigration, and started organizing social work students and law students to go into the detention centers. Back in 2018, we used to have these family detention centers. We had 3 of them in South Texas. So she got a group of students organized, and they would go down to these detention centers and do different support groups for the women and children that were detained there. And just through her hard work, we grew a little bit. We're still kind of tiny, but now we have 4 service areas. So, okay. Our biggest project right now is our training and consultation. So what we do is we partner with Raíces, Catholic Charities, ProBar, different organizations that provide direct services to immigrants, asylum seekers, and refugees in Texas to provide trauma-informed workshops and even just processing groups, because this is really heavy work. We also have a mental health collaborative, which is our other big program, and what we have done is create this model of training mental health clinicians to do immigration evaluations to support immigrant cases. Free of charge for immigrants, because those are very expensive, but we have funding to be able to provide a stipend to people that are volunteering their time to do these evaluations. The social work detention response right now, it's on hold because COVID. It's not as easy to go in. Well, it was never easy, but it's even more difficult to go into detention centers now with post-COVID. And thankfully, those family detention centers are no longer operating in Texas, so that's a good thing. And finally, we have our website, which is Navegando Austin, and this is a website that is just a list of resources that are available to undocumented individuals living in Austin, Texas. Okay, but today, what we're going to talk about is trauma-informed care. But of course, before we can talk about trauma, and I'm sure you guys have heard a lot about this today and throughout this training, but we're going to do a quick overview about trauma, right? Because we need to have a good understanding of trauma before we can talk about, to be trauma-informed. We're going to talk about the ACEs study, a really quick overview of the brain, trauma responses, and then we're going to focus on what is trauma-informed. What is trauma-informed? Because I think it's become a buzzword that we use all the time, but a lot of us don't know what it means. And even when I started in the mental health field, I just kept being told like I was doing trauma-informed work, but I really didn't know what that meant. So I feel like it's really important to have clarity. Okay. Go back. So definition of trauma, tons of definitions out there. This one is one that I like to use. Basically, we tend to think about trauma as an event, but trauma is not an event. Trauma is the response to an event, how we internalize a traumatic event, right? So it's all about how we internalize that event, how it affects us, and how it changes the way that we view and we function in the world. There's different types of trauma. There's acute trauma, which is basically the result of one traumatic event, like a car accident, right? Then there's chronic trauma, which is repeated and prolonged trauma over and over again. So kids that are growing up in abusive households, or a woman or a man that's living that's in an abusive relationship, right? It's repeated, so it's chronic. Then there's complex trauma, which is a lot of different types of trauma that happen to a person. So the majority of the immigrants that I have worked with in my career have complex trauma. Very sadly, I used to work at a shelter for children, and when we had the kid that had the one trauma, we were like, oh my God, like this is a rarity, because they just, had so many different traumas happen to them. So keep in mind that there's those 3 different traumas. And something that I want y'all to remember throughout this presentation is that when trauma happens to us, our brain automatically engages in these things called trauma responses. And those are necessary to survive the trauma, but they become problematic when we engage in those behaviors when we are not experiencing trauma, right? So we're going to talk about that a little bit more, but just keep that in mind about trauma responses. So some of the symptoms of trauma that probably all of us are familiar with, because we live in a world where there's just a lot of trauma happening to all of us. Having feelings of hopelessness, having panic attacks, engaging in self-destructive behaviors like substance use or harming ourselves, things like that. However, it may look different in children, right? Typically, when we talk about kids, we focus on 3 different areas: their behavior, how they're learning, and then how they're relating to others. In regards to behavior, after a child survives a trauma, it's very common for them to have outbursts of anger or aggression that may not seem appropriate, or we're like, I don't know where this behavior is coming from, but that's a trauma response, right? They may become hyperactive or have a lot of issues with controlling their impulses. They might become depressed or isolated. A lot of times we see kids that become very clingy, so sometimes we call it separation anxiety. This happened a lot with the kids that were separated from their parents during the zero tolerance policy. I work with a lot of kids that, they became so clingy to their new caretaker, to this person that they had just met. And, 2 days after meeting this person, they could not be separated from them, right? But that's, they were coping with having been separated from their parent. Changes in sleep and appetite and illness. And that is common because when we suffer trauma, our immune system becomes compromised, right? So kids that experience trauma oftentimes don't, they get a lot of stomach aches, or they, get a lot of like colds and flus because their immune system doesn't work as well. But also, a lot of times is psychosomatic illness, which means there's not really a medical cause. However, they're showing these symptoms of medical illness as a result of their trauma. So kids a lot of times are like, my stomach hurts, I have a headache, and it's all, in their head. It's psychosomatic. Learning, kids have a lot of issues with concentrating in school and retaining new information. The trauma changes the way that our brain works. We're going to talk more about that, but basically it's really hard for a child that has experienced a trauma recently or that is living in a traumatic situation to learn and to retain information. They may also have memory loss. So things that they previously learned, they might not be able to recall after the trauma. And then we see a lot of kids that they're daydreaming or they're easily distracted, but what they're actually doing is that they're disassociating, which basically means they're becoming mentally disconnected from their bodies, right? As a way of coping with something that terrible that has happened to them. And again, they're kind of stuck in that trauma response. So they engage in this behavior when they're not experiencing a trauma. And lastly, relationships, right? I mean, it's a lot of kids, oftentimes the trauma occurs at the hands of their caretaker or their parent. So, they're receiving the message that these people in this world that are supposed to take care of me are not to be trusted. So how can I trust anybody else? They may have poor boundaries, right? Because boundaries is something that we tend to learn from our family and caretakers. And when our boundaries are constantly violated as children, we don't learn how to have boundaries, right? So you might meet a child that, comes up to you and just like gives you a hug or touches you inappropriately or tells you their whole life story after you meet them, right? And that's because they don't understand that, whoa, it's not safe to act in that way or to engage in these behaviors. And then other times we see kids that become very dependent on others and helpless, right? When children are told that they're useless and they're worthless and they're good for nothing, they internalize that, right? And they believe it. So they're just like, well, I can't do anything right, so, I'm just gonna have somebody else take care of it. Okay. So with immigrant children, and immigrant populations in general, there's this thing called the triple trauma paradigm, which is basically 3 different points in time where immigrants tend to experience a lot of trauma, right? So pre-migration, some of the things that children face are extreme poverty, violence. A lot of these kids come from not only violence in their home, but community violence, gang violence, or just, all kinds of violent environments that they have experienced. A lot of them have experienced abuse and neglect. They have a lot of immigrant children, especially unaccompanied children, there's these feelings of abandonment. And it can be real or it can be perceived. What I mean by that is that some unaccompanied children or immigrant children are truly abandoned, right? Like we oftentimes in this field, we encounter kids that were left behind by their caretaker and like they never heard from them again, right? Or I've worked with children that have been in the street since they were toddlers. So they've really been abandoned. But other times, we work with children whose family had to migrate before them in order to provide for them, right? That's a very common experience. However, to that child, they don't have the capacity to understand, oh, my caretaker had to leave me behind so that, they could provide for me. To them, it feels like they were left behind. So that's a very common experience. Exploitation, this is unfortunately, I think, becoming more and more common, or we're just becoming more aware of it, but a lot of these kids have experienced, labor exploitation, sexual exploitation, so it's becoming more and more of an issue. Then we have kids that are living through natural disasters, another thing that's happening more and more, right, with our changing climate. And we know that, unfortunately, climate change is affecting poor communities more. So I think in 2018 or 19, there was 3 horrible hurricanes that, affected Honduras, Guatemala, El Salvador. The next year, I worked with so many kids that just spoke about their houses being washed away. And children coming into the US with no papers to identify them because they had lost everything, right? And so it became very difficult trying to find documentation to prove who they were and how old they were and all that stuff. This is becoming more and more. I think maybe one of the attorneys that spoke yesterday talked about working with kids whose family had lost their livelihood because they were farmers, right? That happens a lot. And then, of course, discrimination. A lot of children that are immigrants, they're not all the same, right? There's children that are indigenous, there's children that are fleeing because of their gender identity or their sexual orientation, and they have suffered such bad discrimination because of that. Migration, their journey is terribly dangerous. They're prey to human traffickers and other criminals along the way. A lot of times there's smugglers that have been paid to bring them here, leave them, like literally just abandon them. I've met children that have been left in the desert to, figure it out for themselves for weeks. Again, discrimination. There's a lot of discrimination along the journey for children that are traveling from South America or Central America. A lot of people I'm Mexican, but there's a lot of really biased views about, people from other countries, right? So they continue to face that. And then added to that, now we have these policies that have created basically refugee camps on the border, right? And living in those situations is extremely traumatic. I work with kids that have been sexually assaulted or, kidnapped while living in one of these refugee camps while waiting to come into the U.S. Post-migration, the trauma doesn't end, right? A lot of them end up in detention. As you guys, I think maybe you all toured one of those facilities, but apprehension itself is very traumatic. A lot of times, a lot of people just literally turn themselves in, but other people, they're really trying to hide from Border Patrol, right? And they're chased. I've worked with kids that have been mauled by dogs because, Border Patrol couldn't catch them, so they, let the dogs go on them, and they've been injured. Of course, being separated from their loved ones, and that's, I think there's this misconception that that's not happening anymore. That is not true. Kids are still being separated from their caretakers every day. And not only their caretakers, but also a lot of these kids travel in big groups of other children that that's their support system. And then they're separated, and that's another loss for them. The detention, so many loss and grief issues that, children are facing. The cultural shock, a lot of kids, they don't expect to come into the U.S. and be discriminated or be put in detention or, I work with children that have told me, Miss, I thought that the moment I crossed the border, I was gonna magically know English, and I don't. Or, just the reality of what it is to be in the U.S. as an immigrant, right? Going to court is so traumatic. Most judges are not child-friendly. As you guys learned, there is no, representation for most of these kids, so that's super scary. Lack of social and community resources. There is a huge need. I mean, U.S.-born children have no access to mental health services or other services that they need. That's even worse for children that are undocumented, right? For a lot of reasons. And of course, discrimination, especially, since the Trump years. A lot of immigrant children have been scapegoated as gang members and criminals, traffickers. So that's, I think that has become worse over the last few years. ACEs. Probably you all have heard about these ACEs, right? ACEs are adverse childhood experiences, basically 10 different things that could happen to a person in their childhood that have been found to have a really significant effect on adult mental health and physical health, right? So they have found that any person that has experienced 4 or more of these experiences in their life have way higher rates of, diabetes, mental illness, substance use, and even suicide. So these are, ACEs are becoming people are becoming more and more aware of that, and we hear a lot about that. And when we think about it, we're like, yes, immigrant children, definitely, they have a lot of ACEs, but what has been found, in the last few years that they've been doing studies on ACEs and immigrant children is that paradoxically, immigrant children tend to score lower than American-born children when it comes to ACEs. And so that's kind of like a head scratcher, and we're like, why is that happening, right? But what's really happening is that these events are really focused on the home. These are things that happen at home, right? Losing your parent to incarceration, abuse and neglect, living with someone that has mental illness. So these are things that happen in the home. Immigrant children don't necessarily fit into this mold, right? A lot of these kids are growing up not in a home environment. So also, the ACE framework does not account for the oppression and the discrimination that immigrant children kind of have to live through, right? So there is this call among researchers and scholars to develop kind of like a addendum to the ACEs, to include other experiences, to that include these kinds of things, the oppression that comes from, being a person of color or not speaking English. So this is a really good quote that I found. I'm not going to read it to y'all, but basically that's what it's saying, right? That we need to open up our thinking about ACEs and immigrant children. So now we're going to talk about the brain. Before I go here, does anybody have any questions so far about anything?
Yeah, just really quick. Henry Gass from the Christian Science Monitor. You mentioned discrimination post-migration and sort of since the Trump administration in particular. Like, is that like just in schools, like in public settings? Like, where is that discrimination happening?
I mean, it's not just since Trump. It's always been there, right? But I think it's more palpable. The schools are a great example that you gave, right? Before I worked for Girasol, I was doing post-release, which is basically the children that leave the shelters and are out in the community. And something that I kept seeing everywhere, not just in Texas, I was working in 6 different states, was that school districts, even though we have laws, right, that state that all children are entitled to an education, it doesn't matter if they're undocumented, where they're from, all children are entitled to an education. In the last 4 or 5 years, it has become very, very difficult to get children that leave ORR facilities into public schools. So school districts have been emboldened to just like come up with these gatekeeping policies that are totally illegal, right? So for example, one of the things they'll say is, we need school records from your home country. A lot of these kids didn't go to school, right, because they didn't have access. Or their school in their country, in their community, was a very small school that was kind of like informal. They don't keep records. Again, natural disasters. I work with a child whose entire school was washed away. And we spent like 5 months trying to locate somebody that worked at the school that could just confirm and like write a letter saying, we have no records. So yes, in school, it's become extremely common for kids not to be able to enroll, but everywhere. There's been so many news stories about, children being gang members. And, I've worked with kids that are trying to, go to school and, learn English. And they are, discriminated by their peers. They're labeled gang members. I've had kids that have been, on their way home to school, they've been beat up because, they were perceived as gang members when they're just trying to, go to school. But it's happening everywhere. You hear about it, people at the grocery store that are, being discriminated in the line by whoever. So I think it's just becoming more and more, people just are more emboldened to speak out like that.
I had a question about ACEs. Through the years, as I've reported on child welfare system and foster kids or whatever, I've heard sort of varying opinions about it. Some have said it should be abolished because it's like forcing a template on a child who's been through this experience whereby some of them are resilient and they don't exhibit some of the basic aspects. So what are your thoughts about whether it's a useful tool?
I think based on the research that I've read, it is useful. It's not a magic thing, right? It doesn't apply to everybody the same. We are resilient in amazing ways. All of us, right? We can survive. There's people that have all ACEs and they go on to do amazing things. So it's not, just because these things happen to you, it doesn't mean that, you have horrible outcomes. There is no hope for you. But it has been found to be a very good predictor. I don't have my notes, so I can't tell you the numbers, but there is a high likelihood of developing certain disorders when you have 4 or more ACEs, and it's both medical and psychological. So it's just like with everything else. It's not going to be exactly like because you have this, it means that there is no hope for you, but they do seem to be good predictors. Okay, so super simple, quick overview of the brain. The brain is amazing. It does millions of functions, but for the purpose of today, we're going to look at 3 areas of the brain and how they are involved with our trauma responses, okay? So starting at the bottom, 2 things that I want y'all to remember. One, our brain develops from the bottom up, and trauma changes our brain, right? And experiences change our brain. Neuroplasticity, right? We know that the more we use a part of the brain, the stronger it becomes, the easier to access it becomes. But starting from the bottom, we have the brainstem. So a lot of times we call that the reptilian brain because it's the oldest part of the brain. It takes care of the automatic functions, our breathing, our digestion, our heart rate, so all the things we have no control over. We never have to think of, like, turn on my breathing now. They just happen, right? Above that, we have our limbic system. Part of the limbic system is our amygdala, which sometimes we call it the alarm system. The biggest thing about the amygdala for today's purpose is that what it does is that it's constantly scanning our environment and it's looking for threats. It's making sure that we're safe. If it senses a threat, it turns on our body's alarm system. So it's the thing that turns on our trauma responses, okay? Above that, we have our neocortex, so our thinking brain. The thing that takes care of all those high-level functions are problem solving, impulse control, planning for the future, self-reflection. All of those functions that separate us from like other mammals, right? The things that make us human. So that's the last part of our brain to develop. That part of our brain doesn't fully stop developing until we're like 25, right? So already, if you think about that, we are very foolish because we expect children to have impulse control and to think logically and to, think about consequences. They can't do that. Their brain literally does not have the ability to do that. They're kids. It's not developed yet. Okay, so already keep that in mind as well, right? In order to demonstrate that, I want to teach you guys this hand-brain model. Maybe some of you know about it, especially if you're a parent, you might know about it. But this is something that was developed by Dr. Dan Siegel, who is a brain scientist and a child psychologist, and he came up with this really useful model. So I'm going to ask you guys to do it with me. It can be left or right hand. Take your hand, and I want you to think about the palm of your hand, the bottom of the palm of your hand, as your brainstem. So the part of the brain that does all the automatic functions, right? Then you're gonna take your thumb and you're gonna fold it over. And this is now going to represent your limbic system, your amygdala, so the alarm system. This part of your brain is like scanning your environment, making sure you're safe. Okay, and then take your fingers, fold them over, and this is your neocortex. So your thinking brain, right? The problem-solving part. If you look at it from the side, it looks like a brain, kind of, right? But what I find super useful about this model is, when I think about, this is the brain of a kid when he's at school and he's feeling safe, he's well fed, he's having a great day, right? So this is an integrated brain. This is a brain that is working at its full potential, right? The amygdala is connected to the neocortex. This kid is able to access all of his brain. He's doing amazing, right? Now imagine that now you're dealing with the brain of a child that is living in a home where there's violence, in a poor community, where his family is always worried about ICE and immigration and are they gonna get deported. This kid is it's feeling threatened all the time, right? So this kid is what we call flipping his lid. This kid is becoming disconnected 50 times a day, right? So 50 times a day, his brain is doing this. So going back to the neuroplasticity, right? We know that the more we use a part of our brain, the stronger and more easily accessible it becomes. So when we're doing this kid's brain, this amygdala, is getting super strong, super hyperactive, but this part of the brain is getting weak, right? Because they're not using it a lot. They're constantly in survival mode. So then it starts to make sense when we talk about kids that go through trauma, get stuck in trauma responses. And then they start acting out when it's, they're totally safe, but they're not feeling safe, right? Because this part of their brain is just like hyperactive, hypersensitive, right? So to me, that is super helpful when I think about children that have experienced trauma, or adults, right? Because children grow up to be adults. They're stuck with a super hyperactive alarm system and a kind of slow neocortex, okay? So now, when we talk about trauma responses, typically we have fight, flight, or freeze, right? Fight are those that are associated with like anger and aggression and attacking, right? Then we have the kids that go into their flight responses where they can they experience a lot of anxiety, a lot of panic attacks. They're very fearful. Literally, I work with kids that literally will take off running. Like I work with a kid that anytime something happened, like even the most minor thing, he just take off running and like literally like wouldn't stop running for minutes until he calmed down. And then I work with kids that flight mentally, right? That just become like, they're not there anymore. Like you're looking at them and they're right there in front of you, but they're gone, right? They fled. And then we have the kids that go into the freeze response, right? Kids that kind of shut down. Selective mutism is one of these responses, right? So kids that literally cannot speak when they're under stress. Kids that literally feel frozen in time. So with some of these, it can be both fight and flight, or a combination of all of these. But these become the thing that they're their go-to under the most, tiniest little stressor. They just go into a full panic response. A full trauma response. So think about, when you are, as a journalist, right, when you're working with a person that has just survived trauma, just because that event is over, again, trauma is not the event, right, it's the reaction. That doesn't mean that their trauma response is turned off. This person might still be in that trauma response, right? So they might not be able to answer questions or tell you their story because they're still having one of these responses.
Hi, I'm Kayla from Street Sense Media in DC, and I've heard a lot about like the fawn as like the fourth one, and I was wondering if you could speak to that at all.
Yeah, yes, fawn there's even more than fawn, right? But fawn is basically people that kind of become compliant, right? So oftentimes we think about people pleasing, right? Or right now I think there's this huge movement of talking about, women are people pleasers. Okay, a lot of that has to do in the way that we're socialized and the way that we grow up. And fawn is kind of, people pleasing is kind of those fawn responses when we just become kind of complacent and will be agreeable. So oftentimes what happens when a child has one of these trauma responses, it's often called like Stockholm syndrome, right? Where they kind of like align with their, the person that's hurting them. So that's a fawn response, right? Where they're just like, they in order to protect themselves, they stop fighting the thing that is harming them. Okay, so trauma-informed practices. What does that mean? Again, we talk about it all the time. A lot of times we don't even know what we're talking about. At its core is basically recognizing that trauma exists and that it changes the way people function and the way that people behave and interact with others. There's the 4 R's of trauma-informed, realizing the widespread of trauma. So again, it's happening to all of us all the time. Like we are living in a world that is very traumatic for some more than for others, but just realizing that trauma does happen, right? Recognizing that it affects people, so there's symptoms of trauma, and that it's going to affect how people interact and how people act. Response, so the response by integrating what you know about trauma in order to change the way that you interact with those people, the way that policies and procedures are happening when working with people that have survived trauma, and most importantly, resist re-traumatization, right? Because even just having someone tell you their story can be traumatizing. Sometimes even asking about trauma can be re-traumatizing. So kind of doing these steps, right? Kind of like acknowledging trauma has occurred. It is going to be affecting the person that I'm going to talk to. How am I going to act towards this person in order not to further harm them? So those are the 4 R's. How does that look like with journalism, right? Learn about trauma and how it affects people. You guys are doing that. I feel like probably I haven't been the only one talking to you guys about trauma, and that's great. And I am happy that I feel like we're talking about trauma more and that we're acknowledging that it affects people. Create safety, right? So more than anything, create safety for the person that you're speaking to. How do you do that, right? It can be something as simple as asking that person, where do you want to be interviewed, right? Do you want to be interviewed in your home or outside your home, sometimes maybe in a public place, even though it might not be, ideal, but maybe that person doesn't feel comfortable being alone with a stranger, even in their home, right? What time of day? Even, asking them, do you need a snack? Do you need some water? Something that is incredibly effective, and I had planned to bring this for you guys today, and I didn't, was like fidget toys. That can be very soothing to their nervous system, right? When we have something to fidget with. Even other things that I find incredibly helpful, especially when working with kids, is having pencils and pens and paper available, coloring pages. Literally, coloring has a therapeutic effect on our brain that allows us to access certain parts of our brain with less distress. Allowing them to tell you their story as they want. So because of the many ways that trauma affects our brain, with our memory, and the way that trauma is stored in the brain, they might not be able to tell you their story chronologically. When talking to immigrant children, it can be very convoluted. And it can take more than one time speaking to them in order to understand. Sometimes, it feels like their story makes absolutely no sense at all, because just the way that they're telling you their story, it is not only their trauma, but also their culture, right? Other cultures don't view time as we do. We tend to be very like, this happened at, this time, and then this happened, and then this happened. That's not how, especially some indigenous cultures, that's not how they operate, right? So you add that to trauma, it's gonna be, it might be very confusing. So giving the opportunity to tell their story as they want, even asking as little questions as possible, I think sometimes can be helpful. Definitely like open-ended questions, right? And not, did this happen, yes or no? Giving them permission to go as far as they want to go, right? And I know that that's probably really frustrating as journalists, right? Because your job is to get the story. And if they're just not willing to go there, but, it's kind of like walking this fine line of, being a journalist, but also making sure that you're not harming someone by trying to tell their story, right? So it can be, sometimes it can also be, especially with children, right? How about you draw out your story? In one of the advocacy jobs that I've had, we worked with these things called life maps, and they were developed by a refugee agency. I can't remember which one, but basically, it's like almost like a comic book that they just draw out for you, right? In order for them to tell you the story in a way that feels safer for them. And part of being trauma-informed is also taking care of your own mental health, realizing that I'm also at risk of becoming traumatized when I work with people that experience trauma. And so that's a huge part of it that often gets missed, right? We're so focused on the client, on the person that we're talking to, that we forget that, I also have to make sure that I'm okay, right? And that can look different for everyone. For example, it can be even before you go to talk to someone that has experienced trauma, making sure that, you take a few moments to ground yourself, to take some deep breaths, to meet your physiological needs. Because, if you're going in there and you've been on a 10-hour flight and you haven't, properly hydrated or gotten enough sleep or, eaten, you are setting yourself up for failure. Like, that's going to impact you more, right? So take care of yourself even before and then afterwards, right? It can be super useful to have somebody to debrief with. Whether that's a colleague, a therapist, a friend, a family member, somebody that you can just talk to and help you process some of that. It can be incredibly therapeutic to just speak about it. And then sometimes you might encounter something that really affects you. I have been, a victim of vicarious trauma to the point where I was driving to work every day in tears because I dreaded it. I was so traumatized by, what I was facing every day that, it literally got to the point where I just couldn't function anymore. That's not healthy. Don't get to that point, right? Take care of yourself proactively and immediately after, and even maybe weeks later it might come up. Okay. So some quotes that I found that I thought were very on point by journalists, right, is that it's really important to humanize the people that you are talking to, right? Because if you are not, if you're just looking at this person as, I just need to get the story, I need to get the information I want, you are already walking in at risk of traumatizing that person because you're not seeing them as a person that has gone through something. So remind yourself, even if it's intentionally reminding yourself, this is a human being. This is a person just like I am. You know, they are as real as I am. That's so important. This person happens to be a journalist and a social worker, but I thought it was a great quote. And then this other one, right? Understanding what they are experiencing before you even show up at the door, right? So I think that I can imagine that as journalists, probably sometimes you might hear about a story and you're like, I have to get there, and you're not really stopping to kind of take it all in. What has actually happened to this person, right? You're just thinking, oh, something happened, I need to get there. Actually take a moment to understand what you're walking into. And again, I don't think this is just for the person that you're interviewing, but for yourself, right? Because if you walk in not with like a full understanding of what you are going to be facing, that is setting you up for being traumatized yourself.
Hi, Aja Sid, Word in Black. I kind of wanted to backtrack a little bit and connect it back to yesterday's session about grief, trauma, and anxiety. How do you, in your work, make a distinction between the two, grief and trauma, and from after you make that distinction, how do you go about addressing it and making sure you're hitting all the points you need to hit if they are grieving versus if they are in a traumatic state?
That is something that for me personally has come with experience and a learning process, right? Because I think that for so long I was told this is trauma work, that I was personally, like, I was missing the fact that this is grief, and not only for the people that it's happening to, but also for the professionals helping, these populations. So one of the trainings that we actually do at Girasol is our work as grief work, not just trauma, but it's going to be different for everyone, right? A lot of times they are co-occurrent, right? People are experiencing grief because of a traumatic thing that happened, a traumatic event. So it's going to be different for everyone, and I think you have to talk to that person individually. The session yesterday, I was actually sitting here when he talked about asking the questions of, what happened to you, right? Like, what happened to you? And then they'll more than likely will tell you, or they might not, right? Because their coping mechanism is maybe like, nope, I'm not going there. But they might tell you. And so I think it's really important to listen to what they're telling you, and then you can figure out, is this person grieving because of what they've lost or what, they can no longer have? Or is it they're just traumatized? Like, people will talk about, I'm waking up in the middle of the night and I'm, I wake up feeling like it's happening again, or they're experiencing flashbacks. Like, okay, well, that sounds like trauma. They can be experiencing grief, but right now, trauma is the thing that they're most acutely being affected by. So focusing on that, and like as a therapist, right, normalizing it for them, being like, this is a totally okay reaction to have. And for me, right, if it's trauma, then I'm like, okay, well, let's focus on getting you to cope with the trauma, and then we can start working on the grief. If it's the grief and the trauma is like, I can't even, I've lost my best friend, this is the thing that I'm worried about, I don't even care that, it happened in this terrible way, I've lost this. They will tell you, and everybody's going to be different. Hope that answers it.
Yeah, it does.
Hi, Kayla from Street Sense. I was wondering if you have any advice for talking and interviewing teenagers specifically?
Oh, yes. It's with teenagers, especially with immigrant teenagers, if you ever get the opportunity to talk to a teenager that's in detention, I think that the most important thing is to give them a sense of they have some control, right? Because teenagers in generally, like, they don't have any control. Like, it sucks being a teenager, right? Because you are at this developmental stage where you are supposed to be exploring and pushing boundaries and acting out. And everybody in society is telling you no, shutting you down. So it's incredibly, teenage angst. It's real. It's not angst. It's like real. It's, the real experience. So always giving them a sense of control as much as you can. It can be, again, as simple as saying, where do you want to go? When I work with kids that were in detention, it was, giving them a choice. Hey, do you want to go sit in my office, or do you want to go for a walk? Sometimes we were allowed to go off campus. It's like, let's go to the park. So just asking them, allowing them to say no, right? Not forcing them to answer questions, because especially with kids in detention, a lot of times they don't have a choice. They have to tell you, right? Like, their attorneys, as much as trauma informed as they are, sometimes there's time pressures where they have to get the story or whatever, right? Sometimes they're forced to tell their stories in order for them to be able to get out of detention. So, allowing them to say, I don't want to talk about that. I think that would be my number one piece of advice, to give them a sense of control and being okay with them setting boundaries.
I'm Catherine Joikett from CNN. Sorry, forgive me. I have one basic question and then a follow-up. So, Girasol, the children that you are working with now are currently detained in unaccompanied minors, or?
So at Girasol, we don't work directly with,
you work with
immigrants. We support the professionals that work with immigrants. So at Girasol, we focus, like, when it comes to unaccompanied minors, right now our focus is creating resources for advocates and others. So we've created a workbook for unaccompanied minors that, is free to print out. For advocates that are working with them, and then we've created an advocate guide. We're working on now translating our workbook from Spanish to English and Haitian Creole. But yeah, we don't work directly with immigrants at Girasol. But I have worked
before
in previous.
Okay, so this might be then kind of secondhand, but I guess just. As you mentioned, a lot of these are kind of long-standing issues, but I'm wondering if there's anything in, like, the last year or so that you've seen or noticed kind of changing in the populations you work with, or that you've heard from the direct service providers is changing.
Definitely. More complex mental health issues. And I think this is a global thing, right? Because we're even seeing that with, American children, that there is a mental health pandemic on top of COVID, right? Way more children that, of course, change in the demographics. A lot more kids from Venezuela, Haiti, Nicaragua, Peru, all of these countries that are kind of imploding. So a change in the demographics, which of course creates new challenges for service providers that have mostly worked with a certain population of kids, and now they're, like, trying to figure out how to, we serve other kids. And I personally, I live in Houston, and I worked in Houston, and one of the things that I've noticed is children disappearing, from schools. Not like they're being taken from schools, but that's one of the ways that we track children, right? When they're in school, and literally kids just being enrolled in school one week, and then the next week they're nowhere to be found. So that has been happening a lot in the last couple of years. And then the other big thing was what was mentioned before, with school systems just being emboldened to create gatekeeping practices to keep kids out of schools.
Yeah, I think we've had a lot of speakers who kind of closed out by giving some recommendations about stories that they would like to see us cover. I'm wondering what stories you might like to see from this group, or what topics you see as undercovered.
Definitely, that's my next slide. Went too far. Definitely, I mean, the things that I just spoke about are super important to me. passionate about working with immigrants, but unaccompanied children and immigrant children are the thing that I'm most passionate about. So those stories, I think that it's important for people to hear about, these kids. One, they're not criminals. They are children, just like your children at home, right? I think that for a lot of Americans, there's this huge disconnect about the humanity of these children, right? So tell stories that humanize them. 2 or 3 years ago, so many stories about like New Jersey, right? I was working with a team in New Jersey at the time, and like every week, story about murder by Central American gang members. That is so rare. It sucks that happened, but there's so many amazing stories of children. I'm an immigrant child myself, right? I came here when I was 10 years old. I would consider myself, pretty successful, right? The majority of immigrant children go on to live, great lives. They, create beautiful lives in the U.S. We never hear those stories. Those are also important, right? Not only talking about the border, right? Yes, it's important, but there's immigrant children everywhere, right? And more, I know that, some of you guys work in the Midwest or unless you're in it, you don't really realize, there's like a huge immigrant population here, right? We never hear about those people unless it's something negative, right? So not just having more of a focus on what it is, the immigrant experience at its fullest, right? Because we often think about the immigrant experience as being that of white immigrants, not including immigrants of color. Including immigrant voices, it is so frustrating to me when I read a story and it's always the attorney and this legal scholar, and it's never like, well, what did Jose say? Like, what did the immigrants say? Like, all these stories that came out over the Christmas holiday about the situation in El Paso. So I did read CNN, maybe you wrote it, about, where they actually talked to a family that was experiencing homelessness on the coldest night of the year in Texas, right? In West Texas. Tell me those. I want to hear that. We need to hear that. That's how you humanize, right? And limit the use of derogatory, dehumanizing language. So as I was researching this, I know that a lot of news organizations have policies about these things, and even, some have gone as far as to say, don't use direct quotes when policymakers or other people are using derogatory language. That is so important. Like, I remember, maybe 4 years ago, I was driving in my car, and I'm like a huge NPR nerd, right? And I heard them say illegal, and I turned it off, and I was like, I'm not listening to NPR I don't want to listen to them, because that is derogatory, dehumanizing, and we continue to. They're not illegal, right? They're human beings. They're undocumented. It's much more of a PC word, right? So those, but as far as like specific stories, I wish that there was more coverage about that, right? Like about school districts breaking the law and saying kids cannot come into our schools, about children that they're victims of human trafficking or who knows what else, right? Because these kids are going missing and nobody is like paying any attention. That, and also, about again, the people that are here that have made lives and that came as immigrants and overcame all these things.
I'm wondering, with the school districts breaking laws, do you have any tips for us how we find out if our school system is doing that?
Most communities that have immigrant enclaves, right? They kind of gather at certain apartment complexes or certain neighborhoods. Talk to the parents that are trying to enroll their children in school, because that's how you're going to find out, right? The school is not going to say, oh yeah, we are, engaging in gatekeeping practices. But when you go and you talk to parents, that's when you hear about it. They're like, I've tried, I've done all these. Talk to advocates that are working with kids that are out of detention, right? So post-release service providers, legal service providers, the Young Center. I don't know if you guys are familiar with the Young Center, but they're the only child advocacy group in the United States that focuses on working with unaccompanied children while they're detained and after. So those are good places to go to find out because it's happening in a lot of places.
Hi, I'm Madison Lambert. I'm based at the Post Crescent in Appleton, Wisconsin, with the States USA Today network. And I know with us, a lot of our field comes with wanting to get the story out quickly and let people know. And I have kind of always wondered what recommendations you have for when you are on a deadline and a tight deadline and you want to include people's voices, but you also don't want to re-traumatize them. Like, you understand that this is something really fresh for them. Maybe it's a school shooting or something that just happened, and you know, like, the kids, you want to include people who were there. How would you go about that?
I guess as a non-journalist, what it brings to mind for me is, right, as a mental health clinician, and one of the things I do is I do immigration evaluations, right? And a lot of times I'll ask a question and, you know, I explain to them why I'm asking the question, and I always let them know, you know, if you don't want to answer the question, that's okay. And then I have to use my skills as a mental health therapist to say, okay, this person cannot talk about it, not because they're being difficult, but because they're affected by it. So, you know, I again, I'm not a journalist, but maybe using those skills that you have as a storyteller to tell us the story about the person, about how they're presenting without saying the words, right? About, you know, this person was, you know, how they're reacting to what happened, or, you know, what they say when you do gently ask the question and you give them permission to turn you down, you know, what their response is. I think that can be valuable too, right? Because that also speaks to trauma, right? Because that is an effective trauma that people cannot speak about it.
As with all of our speakers, your email address is on the program. And so I'm hoping we can count on you and get in touch with you if we're starting to try to do these stories. But this has been a wonderful conversation about an issue that so many of us have challenges with. So I want to thank you on behalf of MPF and on the fellows for joining us today.
Thank you so much.